That nagging foot pain that just won't go away, physical therapy might be the solution you haven't tried yet. My name is Dr. Andrew Schneider, and I'm a podiatrist in Houston, Texas. After treating thousands of patients with foot pain, I've discovered that physical therapy can be incredibly effective for many foot conditions, often avoiding the need for surgery or long-term medication. What most people don't realize is that physical therapy for foot pain goes far beyond simple stretching. In today's video, I'm going to show you exactly how physical therapy can resolve your foot pain, which conditions respond best to this approach, and what you can expect from the treatment. You'll learn about specialized techniques, exercises you can do at home, and how to know if physical therapy is right for your specific foot problem. Before we get started, please take a moment to hit the like button and subscribe to the channel with the notification bell. This helps others with foot pain find this crucial information, and I post new videos every week with important foot health content. Most people think that physical therapy is just for athletes or people recovering from major injuries, but that couldn't be further from the truth. Physical therapy for foot pain is one of the most underutilized treatments available, yet it can be extremely effective for a wide range of conditions. The reality is that many foot problems stem from biomechanical issues, problem with how your foot moves and functions. These issues can't be fixed with medication alone, and they often don't require surgery. What they need is a targeted therapy to restore proper function and movement patterns. Physical therapy isn't just for athletes or injuries because foot pain often develops gradually due to poor mechanics, muscle imbalance, or compensatory movement patterns. These problems affect people of all ages and activity levels, from office workers who stand all day to weekend warriors who push their feet beyond their current capabilities. When patients first come to my office, they often say something like, "I've tried everything," or "nothing seems to help." What they usually mean is they've tried rest, ice, over-the-counter medication, maybe some basic stretching, but they haven't tried comprehensive physical therapy designed specifically for their foot condition. The frustration is understandable. Foot pain can be incredibly limiting, affecting everything from your daily activities to your sleep quality. When simple remedies don't work, many people assume they need surgery or that they'll just have to live with the pain. Physical therapy offers a middle ground that can be remarkably effective. What does physical therapy for foot pain actually look like? It goes far beyond heat packs and basic stretching that many people associate with physical therapy. Modern foot and ankle physical therapy incorporates sophisticated techniques designed to address the root cause of your pain. Manual therapy is a cornerstone of effective foot physical therapy. This involves hands-on techniques where the therapist uses their hands to mobilize joints, release tight tissue, and improve circulation. For foot conditions, manual therapy might include massage of the plantar fascia, mobilization of stiff joints in the midfoot, or release of tight calf muscles that contribute to foot problems. Joint mobilization is particularly important for foot conditions because the foot contains 26 bones and 33 joints. When these joints become stiff or don't move properly, it can create a cascade of problems throughout the foot and ankle. Skilled manual therapy can restore proper joint motion and reduce pain significantly. Gait retraining is another crucial component that most people never consider. How you walk affects every step you take, and poor walking patterns can perpetuate foot pain indefinitely. Physical therapists trained in gait analysis can identify problematic movement patterns and teach you how to walk in ways that reduce stress on painful areas. Targeted strengthening goes well beyond general foot exercises. Different foot conditions require strengthening of specific muscle groups. For instance, plantar fasciitis often benefits from strengthening the intrinsic muscles of the foot, while posterior tibial tendon dysfunction requires focused strengthening in the muscles that support your arch. Custom plans based on diagnosis are essential because different foot conditions require a completely different approach. A one-size-fits-all approach to foot physical therapy simply doesn't work. Each condition has specific requirements for optimal healing. For plantar fasciitis, physical therapy typically focuses on stretching the plantar fascia and calf muscles, strengthening the intrinsic foot muscles, and addressing any biomechanical issue that contributed to the condition. Techniques might include specific stretching protocol, eccentric strengthening exercises, and manual therapy to release tight tissues. Achilles tendonitis requires a different approach entirely. Treatment often emphasizes eccentric strengthening exercises, which have been shown to be particularly effective for tendon healing. The therapy might also include techniques to improve ankle mobility and address any contributing factors like tight calf muscles or poor foot mechanics. For bunions, physical therapy can't reverse the bony deformity, but it can address the pain and functional limitations. Treatment might focus on improving toe mobility, strengthening muscles that support proper foot alignment, and teaching strategies to reduce pressure on the bunion during daily activities. Neuromas, which are thickened nerves that cause burning pain in the ball of the foot, often respond well to techniques that reduce nerve irritation. This might include manual therapy to improve tissue mobility around the nerve, exercises to improve mechanics, and strategies to reduce pressure on affected areas. Postoperative rehabilitation is crucial for optimal surgical outcomes. Even after successful foot surgery, physical therapy is often necessary to restore full function, strength, and mobility. The therapy helps to ensure that you get the maximum benefit from your surgical procedure. The top 5 ways physical therapy helps foot pain demonstrates why this approach can be so effective when other treatments have failed. Understanding these mechanisms help explain why physical therapy often succeeds where other approaches fall short. Restoring proper biomechanics is perhaps the most important way physical therapy helps foot pain. Many foot problems develop because of faulty movement patterns that place excessive stress on certain structures. Physical therapy identifies these problematic patterns and teaches your body to move in ways that reduce stress on painful areas. This biomechanical approach is crucial because it addresses the root cause of many foot problems rather than just treating symptoms. For example, if your foot pain is caused by excessive pronation during walking, simply treating the pain without correcting the pronation will likely result in the pain returning once treatment stops. Realigning how your foot functions during walking and standing can have profound effects on pain level. Small changes in foot mechanics can dramatically reduce stress on painful structures. This is why physical therapy often provides lasting relief. It teaches your body new, healthier movement patterns. Preventing compensation in future issues is another major benefit. While one part of your foot hurts, you naturally compensate by changing how you walk or stand. These compensations can lead to problems in other areas of your foot, ankle, or even your knee or hip. Physical therapy addresses these compensations before they become an additional source of pain. Reducing pain and inflammation through physical therapy techniques can provide significant relief without the side effects of medication. Manual therapy techniques can improve circulation, reduce muscle tension, and promote healing. Modalities like ultrasound and electrical stimulation can help reduce inflammation and pain at the cellular level. These techniques work by promoting your body's natural healing processes rather than simply masking symptoms. This approach often provides more lasting relief than medication alone and can help reduce your dependence on pain medication. Improving flexibility and range of motion is critical for many foot conditions. Stiffness in the foot, ankle, or calf can contribute to a wide range of foot problems. Physical therapy uses specific stretching and mobilization techniques to restore normal flexibility and range of motion. This is particularly important for conditions like big toe stiffness, tight Achilles tendons, or postoperative swelling. Restoring normal motion allows your feet to function properly and reduce stress on painful structures. Strengthening supporting muscles help offload injured areas and provide better support for your foot's problems. Many foot problems develop because certain muscles become weak or don't activate properly. Targeted strengthening exercises can restore proper muscle function to reduce stress on painful areas. This is especially important for chronic conditions where muscle weakness may have developed over time. Strong, properly functioning muscles provide better support for your foot's bones and joints, reducing the likelihood of future problems. Preventing recurrence of pain is one of the most valuable aspects of physical therapy. Unlike treatments that simply provide temporary relief, physical therapy teaches you strategies and exercises you can continue to use long-term to prevent your foot pain from returning. Education on body mechanics and long-term home exercise programs give you the tools you need to maintain the improvements. The educational component is crucial for long-term success that helps ensure that your foot pain doesn't return once formal therapy ends. When should you start physical therapy? The answer might surprise you. Earlier is almost always better. Many people wait until their foot pain becomes severe before considering physical therapy, but early intervention is much more effective and often prevents the need for more aggressive treatments. So don't wait until the pain is unbearable because early intervention leads to faster recovery and better outcomes. Foot problems that are addressed early often respond much more quickly to physical therapy than chronic conditions that have been present for months or years. Physical therapy is great after surgery, but it's also an excellent alternative to surgery for many conditions. Many foot problems that were once thought to require surgery can now be effectively treated with comprehensive physical therapy programs. This is especially useful before considering surgery for bunions, heel pain, and tendon issues. Physical therapy can also provide significant relief and improve function without the risk and recovery time associated with surgery. Even if surgery eventually becomes necessary, physical therapy can optimize your condition before surgery and improve your post-operative outcomes. What to expect at your first physical therapy session includes a comprehensive evaluation process. The therapist will assess your range of motion, strength, balance, and gait patterns to identify the factors contributing to your foot pain. This thorough evaluation is crucial for developing an effective treatment plan. The evaluation process goes far beyond simply looking at your foot. The therapist will examine how your entire lower extremity functions, as problems in your hip, knee, or ankle can contribute to foot pain. This comprehensive approach helps to ensure that all contributing factors are addressed. How your progress will be measured includes tracking patient goals, functional improvements, and pain reduction scales. Your therapist will work on you to establish measurable goals and will regularly assess your progress towards achieving these goals. This systemic approach to measuring progress helps to ensure that therapy is effective and allows for adjustments to your treatment plan as needed. Regular progress assessments also help keep you motivated and engaged in your recovery process. If you found this information helpful, please share the video on social media. Your simple share can help someone find relief from chronic foot pain through physical therapy. Also, leave a comment below if you have a question about physical therapy for foot pain. I do my best to respond to everyone. If you're dealing with persistent foot pain that hasn't responded to basic treatments, don't wait. Schedule a consultation to discuss whether physical therapy might be right for your specific foot condition. We can evaluate your situation and help you understand how physical therapy can help resolve your foot pain. The link to schedule an appointment is in the description below. Thanks so much for watching, and have a great day.